Reimbursement is not guaranteed, right? Okay, so why does your documentation matter? Your documentation, when it comes to hospice, is not just about paperwork. And a lot of the time, we always think that the nurse's documentation is what surveyors are looking at. It's what any auditor is looking at. Unfortunately, that's not true. They are looking at every single member of the team's documentation. So what they pay a lot of attention to is that whether the patient is meeting eligibility criteria for hospice services. Some of the things that surprised a lot of people is reimbursement. Reimbursement is not guaranteed, right? Documentation does. So every note you write contributes to a larger narrative about the patient's condition, the decline in their need. What does that mean? It means that the chaplain, social workers, nurses, all of you play a critical role when it comes to hospice eligibility, not just the physician. And I know as social work and chaplain, sometimes we think, oh, it's just the nurse's documentation that's being reviewed. That's not the case. The same way a chaplain or social work documentation helps boost and show hospice eligibility, it also can have a claim be denied because of what the social worker is writing. That shows that's very different from what the nurses are writing. So that's why it's very important that all of our documentation align. So whether you're reflecting on the spiritual suffering of the patient, the family dynamic, psychosocial distress, or any type of emotional changes, your observation may be missing a lot of the pieces that confirm a patient is terminally ill or the prognosis of 6 months or less. So one other thing that you need to think about is when you're writing, does your words support eligibility? Does the care plan that you're writing, is it showing eligibility? If a surveyor and an auditor is reading your note, would it show that this patient is hospice appropriate? And the main key thing that we were all there when we were for hospice is, are we advocating for the patient's needs? So when you're documenting, you have to make sure you're documenting clearly, thoroughly, and you're not just complying with the standard.